Hi, my name is Connor Dunoy. I'm a student physical therapist here at RMU. I'm here with my patient Katie. She is a 66-year-old female who had a total knee arthroplasty in her right leg about 3 weeks ago and is having some difficulty getting to full knee extension and is lacking some right quad strength at the moment. So at the moment I'm thinking about trying some NMES to help strengthen that right quad to help get to that full knee extension. So an indication would be that total joint replacement. Some contraindications would be any active cancers, any history of epilepsy or seizures, any cardio issues, any arrhythmia, hypotension or hypertension, or any electrical implants. So I would ask my patient beforehand about any of those, and then while I'm doing that, I would assess any cognition issues. So to set it up, I would consider some Russian for this strengthening. Golly gee, there it is. Sure hope this is in. So I'm going to select Russian stimulation right here. I'm going to keep it at normal, and since it is early on, I'm going to do a 10 by 50 duty cycle, so 10 seconds on, 50 seconds rest to help ease that patient into that process, and then as we progress we can shorten that cycle. I'm going to do a 2-second ramp time to help, again, ease that patient in, but once they get used to that, we'll decrease that ramp cycle. And then we go for intensity, being until we can get a 50% voluntary muscular contraction, and I would test that by measuring the other side. And I'd be using these 2x4 strips to help decrease the amount of intensity that if I were to be using a 2x2 pad, it'd be a little bit more intense, so this would distribute that electrical signal a little bit better. So I'll check in with our patient now. Hi Katie, how you doing today?
Oh, I'm okay.
So I know your knee hasn't been able to get that full extension.
Nope.
So, and your quad's been a little weak lately, is that right?
Yeah, unfortunately.
So I was thinking about trying some intervention that we can try. It's called electrical stimulation. Might sound a little scary, but have you ever used that before?
Yeah, at the chiropractor's office, yeah.
And what was that used for?
Just for pain, I think.
Just pain?
On my neck.
And would you just get some little tingles here and there for it?
Yeah, sometimes a little bit of muscle spasm,
Okay.
not much.
So this works very similar. We'd throw some electrodes on there to help transfer that energy into it, but it's using a little different technique.
Okay.
And what we would do is put 2 of those pads on your quad, and I would get the distance just right. But that would just help stimulate the muscle fibers to contract, and that would help you get that full contraction.
Okay, so you want me to try to think about contracting my quad? Okay.
And I want you to do it as much as you can, at least
Okay.
half of what your other leg can do is what we're going for.
Okay.
That makes sense?
Yeah.
Okay. So I just want to make sure that you're cleared to do this, and just want to make sure that there aren't any issues that would interfere with that.
Okay.
So are you aware of do you have a pacemaker or any electrical implants?
Nope.
Okay. Do you have any active cancer at the moment?
No.
Currently pregnant?
No, I stopped having. Yeah, I'm done with kids.
Do you have any cardiac issues, any abnormalities, arrhythmias?
Nope.
Any hypertension, hypotension?
Nope.
Okay. So it sounds like you're a great candidate for this. So these are the pads that we would use. So just a little sticky on one side and then hooked up to the machine right here. So do you mind if I put these on?
Yeah, that's fine.
All right. So I'm gonna put the first one right about here. Then I'm gonna put the second one fairly close, not too far apart, because the further away it is, the deeper it penetrates that muscle. But we aren't going too deep at the moment.
Okay.
So what you should expect for this one is some tingling at first, And then that muscle is going to start to twitch a little bit.
Okay.
And then once that twitching happens, then it might feel like a stronger contraction to help those quads fire.
Okay.
That makes sense?
Yeah.
If it's sharp or painful, just let me know because that's going a little too much than what I want to.
Yeah.
Okay?
Yeah.
All right. So I'm gonna start increasing the intensity here. You just let me know when you hit that tingly sensation.
Okay.
And if you are uncomfortable at any point, just let me know.
Okay.
All right?
I feel it tingly now.
Tingling, okay. Does that feel all right? Too much? So it's gonna contract for 10 seconds and then it'll relax for about 50 seconds, so you got a nice long rest break. I'm gonna give you the spell. You doing all right? Okay, go ahead and ring that bell if it's too much at any point. But as you're doing it, I want you to try to squeeze those quads while it's going on. All right? All right. And this timer's going here, but I'll set a second one just to be safe. We'll go about 10 minutes, so should be 10 reps total.
Okay.
So not too much. How's it feeling so far, though?
It's on the rest. Thank
Good.
God.
All right, I'll check back soon.
Okay.
How's it feeling, Katie? Come on, good strong squeeze.
Okay.
Okay.
It feels great. I feel like
Good
I'm
strong
alive.
contraction.
Yeah.
All right, we'll go a little bit longer, and then we'll shut it off. All right?
Sounds
All right.
good.
All right. How's it feeling?
Oh, I feel great.
Feeling great?
Yeah, I feel like I was really able to contract my quad there.
Well, let me just check and make sure that skin's looking good. Doesn't look like there's any burns. Feeling a little sore? You might expect some soreness. That was it.